Hello and welcome to NTD Canada News Election Special Series. I'm your host, Gary Bai. The Justice Centre for Constitutional Freedoms responded to Ontario Premier Doug Ford's announcement by calling it a medical order meant to coerce Ontarians to get COVID-19 vaccines. It is considering challenging these laws in court. Advocates are seeking for more help from the contending parties to address the opioid crisis, calling for more detox facilities and treatment beds. They say that solving the opioid crisis should be front and center in this election. On Labor Day, Liberal leader Justin Trudeau was in Welland, Ontario, and made an announcement with Liberal candidate Chrystia Freeland. He spoke about how the Liberals plan to continue supporting Canada's workers and businesses. He stated through important emergency support like the Canada Emergency Wage Subsidy, we were there so businesses could keep their doors open and employees could keep food on the table. The Liberals also have several other measures they plan to implement to help support workers. Conservative leader Erin O'Toole was in Ottawa, Ontario. He made an announcement to give working Canadians a $1 an hour raise. Canada's recovery plan will double the Canada Workers' Benefit up to a maximum of $2,800 for individuals or $5,000 for families, paying it as a quarterly direct deposit rather than a tax refund at year-end, said O'Toole. This will help 3.5 million families pay the bills and put food on the table. For someone earning between $12,000 and $28,000 per year, it represents a $1 per hour raise. NDP leader Jacques was in Hamilton, Ontario. He spoke about paid sick leave and childcare. Paid sick leave would allow workers 10 federally regulated paid sick days a year so that they can recover and not worry about family expenses. The childcare program would allow families to send their children to childcare at a reduced cost so that they don't have to give up their jobs to avoid expensive childcare. Bloc Québécois leader Yves-François Blanchet was in Blainville, Quebec. He spoke to journalists about ideas to help workers. Green Party leader Annamie Paul was in Toronto. However, her news conference at Moss Park Apartments was cancelled. People's Party leader Maxime Bernier was in Manitoba and held 3 events on Labor Day. The first was in Steinbach, the second was in Plum-Coulee, and the third was in Winnipeg. Over the past few days, wherever Trudeau has gone, he has been faced with protests against mandatory vaccination. The crowds along Trudeau's campaign trail have often held signs objecting to the vaccine mandate and have shouted at Trudeau. Trudeau has responded by calling these people a fringe group. Several hundred people rallied in downtown Toronto this past long weekend to voice their opposition to the vaccine mandate rolled out in Ontario in the past week. Starting September 22nd, people will need to provide proof of vaccination along with a photo ID to access non-essential services such as restaurants, bars, gyms, and other indoor facilities. The Justice Centre for Constitutional Freedoms responded to Ontario Premier Doug Ford's announcement by calling it a new medical order meant to coerce Ontarians to get COVID-19 vaccines. It is considering challenging these laws in court. The Justice Centre said in a news release that these new vaccine passport laws grant the government a plethora of power that can allow the province to create similar and more far-reaching measures in the future. In Ontario, the government has now officially implemented a 2-tier society where those who are not vaccinated will be severely stigmatized and prevented from accessing goods and services that Canadians are entitled to in a free and democratic society, said the centre. According to the Justice Centre, this vaccine passport was made possible by an overarching amendment to the regulations under the Reopening Ontario Act that governs most COVID-19 related restrictions and mandates in the province. George Pineda, staff lawyer with the Justice Centre, stated vaccine passports are a blatant and unjustified violation of charter rights and freedoms, and these new regulations impact the choice that Ontarians have over their personal bodily autonomy. They stigmatize the unvaccinated and they strip away the choice of business owners to decide how they wish to conduct their business. The coming days and weeks will reveal how severely vaccine passports will be reinforced. Pineda said the Justice Centre is deeply concerned about the increasing trend of authoritarian laws in the name of public safety and is carefully reviewing these new laws and considering challenging these laws in court. According to the Centre, Section 7 of the Charter guarantees the protection of life, liberty, and security of the person. Coercing Ontarians to inject COVID vaccines that are still undergoing human trials or submitting to any other drug or medical treatment interferes with bodily autonomy, an interest that is protected by the Canadian Charter of Rights and Freedoms. The government is requiring these experimental injections as a condition of full participation in society. Vaccine passports also violate the principles of equal treatment under the law protected under the Charter. Individuals who have not been vaccinated for a variety of reasons, including religious belief, creed, and medical issues, will now be segregated, and their participation in society will become limited to what is deemed essential by the government, said the center. In Canada, people have a right to decide what medical treatment they receive or do not receive. The COVID shots are new, and clinical trials will not be complete until 2023. Each of the shots also contains warnings from Health Canada, including warnings about pericarditis or inflammation of the sac that surrounds the heart, myocarditis or inflammation of the heart muscle, and thrombosis or blood clots, at the center. The Justice Center says both unvaccinated and devaccinated spread COVID-19 in equal measure, as members of both groups carry the same high viral loads when infected, according to data from the Center for Disease Control. Sayed Hassan, a lawyer for the Justice Center whose family fled Iran's revolution, said, "We have seen the impact of segregation of certain factions of population in history and how those incremental steps to segregate have led to the loss of freedom of many in those populations. This is a dangerous precedent to set in a free and democratic society where people are considered equal and protected under the Canadian Charter of Rights and Freedoms." And coming up, we have the parties address the opioid crisis in Canada. But first, please subscribe if you're new to this channel and turn on that notification bell so you won't miss any new videos. We'll be bringing you election updates from coast to coast in the coming weeks, along with the latest news coverage. Thank you for your support. Now let's get back to our stories. Advocates such as BC Chief Coroner Lisa Lapointe are asking for more help from the contending parties to address the opioid crisis, calling for more detox facilities and treatment beds. They say that solving the opioid crisis should be front and center in this election. According to the Public Health Info Base of the Government of Canada, over 21,000 Canadians died from opiates between January 2016 and December 2020. Record-high drug overdose deaths have been reported across the country during the pandemic. In Toronto, for example, the 2020 death toll of 521 people represented a 78% increase from 2019 and a 280% increase from 2015. In a 2019 publication of The Lancet, at the core of the opioid crisis is a lack of systematic measures to reduce drug-related deaths. It traces the opioid crisis to the early 2000s, when increasingly potent medical opiates were prescribed to those who needed them. Then, as the harmful effects of opiate exposure became apparent, it was decided to reduce the supply of medical opiates. At the same time, the illegal supply of synthetic opiates surged to fill the supply gap, and those who were previously dependent on the drug become addicted. The major contenders in this federal election had pitched their solutions to the opioid crisis. The Tories promised to invest $325 million to increase the number of treatment beds to 1,000 and build 50 recovery community centers across the country. They also plan to work with Indigenous communities to provide culturally appropriate addiction treatment and prevention services. On the other side of the aisle, the Liberals pledged to invest a minimum of $600 million to address the opioid crisis and $500 million to provide access to evidence-based treatment across the country. They also plan to reform the criminal code to repeal mandatory minimum penalties for low-risk offenders. And the NDP pledges that, if elected, it will declare the opioid crisis a public health emergency and the criminalization and stigma of drug addiction and support overdose prevention sites. With that said, thank you for watching NTD Canada News. If you like this video, please give us a like and share. It will help more people see our channel. We'll be back with more comprehensive election coverage, and we'll see you next time.